Thank you. The last presenter is Dr. Sonali Prasad.
A very good morning, everyone. First of all, thank you, AIOC, for giving us the opportunity. I'm going to talk about epidemic keratoconjunctivitis among the healthcare workers, the knowledge, attitude, and practice patterns in India. So as we all know, epidemic keratoconjunctivitis is caused by adenoviral with serotype 8, 9, and 37, and the transmission is mostly through fingers or objects or swimming pool. So recently we saw there was a sudden outbreak of pink eye in the general population, and due to its indistinctness, different sources of information and suggestions were developed to guide and prevent the spread of the disease. But to our surprise, despite the knowledge, awareness, proper precautions, the disease also spread among the healthcare workers. So we conducted a pan-India cross-sectional survey to understand their knowledge and perception. So this was a Google form constructed with the help of different peoples all around India, and we concentrated on the demographic details, their experience with viral keratoconjunctivitis, their knowledge, attitude, and practice, and we did a pilot study in 10 subjects, and the validation certificate was taken by the statistician. We took help from social scientists, epidemiologists, and medical doctors to find a study that was suitable, applicable, relevant, and also accurate. So after this online cross-sectional survey that we created, we translated into 2 languages and disseminated it through the help of social media and conducted the survey for 2 months. And we got around 1,092 respondents. We also developed a scoring and analysis system for this. All the responses, the data was, the responses from the Google spreadsheet was converted to Microsoft Excel. And scoring, we did +1 for each correct answers of the multiple choice, and total score of 40 was taken. The cutoff for every knowledge, attitude, and practice was taken as more than the median value. So if the knowledge was more than 18 out of 24 score, it was graded as high knowledge, and for attitude 4 out of 6, it was more than that, then positive, and for practice it was 7 out of 10 was good. So the demographic details, we could see the male and the female were just similar. The doctors were maximum in our group, with nurses being 21. Mostly from the private sector, and the postgraduates and undergraduates were the maximum in number. In the geographical distribution, we can see the central India having the maximum number of respondents, and the extreme peripheries of India could not respond well. Talking about their episodes of conjunctivitis, around 68% had an episode of conjunctivitis with contact with infected patients in OPD was the most common reason. The redness in eye was the most common symptom that they faced, and the severity was of mild grade. The associate symptoms were seen at around 42% showed about fever, and 19% showed preauricular rhinitis was seen in 7%. Most of the respondents were treated with artificial tear drops with antibiotics, and the others were treated with steroids. Their experience was different, and around 40% showed that they had no sequelae of the recovery. Talking about knowledge, we assessed them in 10 questions. I'm not going to go into detail of the question, but when we analyzed, we had around 1,092 respondents, and 841 had a score of more than 18, giving us a score of 77% of good knowledge. Coming about attitude, again, 78.5% had a good positive attitude. The practice patterns concentrated, and 748 respondents scored more than 7 out of 10, giving us a score of 72% having a good practice. So in conclusion, 68% of the the respondents that we had were healthcare workers working in private sectors. 72% had contact with the infected person in OPD. The most common symptom they had were redness followed by pain, itching, watering, then discharge. The grading of the severity was 1 to 2, and 54% had artificial tear drops with antibiotics as a treatment. So we concluded that the overall CAP analysis of the Pan-India survey was 72% had a good knowledge about the disease, with 78 had a positive attitude, and 72 had a good practice. Thank you so much.
Thank you.
Sir, actually, the methodology is we've constructed this Google Docs, and then we asked the statistician, and we did a validation of the questionnaire had 12 in the knowledge, attitude, and we had divided it accordingly, according to the, and then the statistician's validation we got a certificate from her by doing a pilot study. After the corrections and everything that we got, we distributed it up to Pan-India with the help of social media. And after that, we analyzed the scoring system was based on a scoring system given by during a COVID paper that was in the literature. So we followed their scoring program in our study, sir.
Thank you. This concludes the session.
Thank you,
So
sir.
we